going to be doing a glute and full back massage for the lovely Michelle. And I would like to mention that Michelle is modeling a really cute pair of bikini bottoms that we produce ourselves, and you can find the link in the shelf below, so you should definitely check it out. So let's go ahead and get started. You know, tightness showing up in the back is definitely connected to the glutes more often than not. I'm gonna go ahead and start with one of my favorite stretches for the low back, and it's really good for the hips. So I'm just gonna tilt this pelvis a little bit. I'm just pressing on the sacrum and pressing away and down slightly, and just really offering some decompression to the low spine. Feels really nice. And I like to stretch out this connective tissue a little bit along the iliac crest, and offering some compressive work in that glute as well at the same time. Really just encouraging that whole area to open up a little bit as I press on that glute medius. And I'm gonna start focusing more on this glute medius to start, and just warming everything up with my fist before I go in with my elbow. And honestly, this compressive work is easier if you're working over a sheet. It's easier to kind of stick to the muscle belly than trying to work skin on skin with this kind of thing. So I'm gonna go ahead and start going in with my elbow. I never introduce my elbow until I feel confident that this area is ready for deeper work, and that I'm clear about, you know, what's going on, more or less. And just remember, you know, when you start to offer more pressure, it's easy to forget like how intense it can feel. So just remember to give your client little breaks, little pauses if you're doing deep tissue work. This is a great distraction technique as well, just offering a little bit of movement. I always start with the glutes if they're a bigger part of the massage, just because the releases that you get in these muscles, it's going to affect the whole back in a really positive way. I like to take my time with this glute medius. This is a nice little break, just some gentle shaking, just giving Michelle little pauses, because deep tissue work can feel weirdly like satisfying, but it can be really uncomfortable. And just a little bit more, this glute medius. This is a great muscle to work on if your client's having acute low back pain or mid back pain, or tension in the hips. And I'm going to go ahead and move into this glute max, and I'm going to go ahead and just change position. I never really feel like I'm getting a whole lot done with this compressive work without some movement of the leg, just so I can isolate the muscle fiber a little more. But this is a great way to at least do some soft tissue work and give Michelle a bit of a roadmap for what we're going to be doing. And really just encouraging Michelle to relax that leg. And I'm going to start sinking my weight in a little bit more, these deeper layers of muscle fiber. I would say of all the glute muscles, the glute max is maybe the most stubborn. But trying to rush through this kind of work is never really that helpful. And if your client is kind of fighting the pressure that you're offering, it's always a good idea to just go a little bit lighter and definitely communicate. You know how things are feeling. And you can, create a totally different tool depending on how you position your fist. So if you want a firmer tool, you can just tuck your fingers under. It's gonna be quite a bit firmer surface area that you're working with. Or if you want something a little bit more pliable, you can just tuck those fingers out, create a softer surface area. Anytime that there is resistance on the part of your client, if you feel like they're kind of fighting the pressure that you're offering, you want to make sure your fist is nice and soft and just kind of take a step back with the pressure that you're using. And you'd be surprised how that muscle can just kind of start to melt just so long as you're letting your client take the lead. And you want to have a lot of responsiveness in this glute max before you even attempt to work on the piriformis. And the piriformis is a deep muscle. It's more challenging to work on. I'm just starting to gradually sink my elbow in. Elbow work, the elbow as a tool is great, but it doesn't mean that you just immediately jam your elbow in. You want to use a good bit of finesse, and you want to just allow each layer of tissue to open. You don't want to ever try to force anything. Deep tissue work can be very healing if it's done, correctly. But if you try to rush it when the muscle fiber isn't really ready, it can be harmful. And you can cause a lot of inflammation. It's just really unnecessary. I've I've had 1 or 2 massages where I've walked out and felt definitely worse. And so I never want that for my clients. It's totally okay for your client to feel a little sore, but it should be a good sore, kind of like when you have a good workout. It should be a similar feeling. And so I think that's enough for the glutes today, and I usually end up spending more time on the glutes than I plan on. I'm going to do a little bit of back work to finish. Whenever I'm running short on time, I like to just use techniques where I'm not having to move from, side to side. And I can just stay in one place when I'm working. It's just more, time effective. And after that wonderful glute work, it's really nice with this effleurage stroke if you can bring it all the way into the hips. It's just a lot more satisfying than a shorter stroke, but definitely make sure that your client's comfortable with it. Because if I were working on a client, they would be draped, and you do need to be careful anytime that your hands go beneath that, line of the sheet where it usually is. And these are just a few techniques that I use if I don't have a lot of time and I want to do a full back massage, even if it's just 5 minutes. After that glute work, this area around the iliac crest is usually a lot more relaxed, so it's great if you can at least include a little bit of work just around the iliac crest and into this thicker connective tissue. Just bringing that stroke across that iliac crest. And on the way back up, focusing more on those traps. And I'm going to go ahead and finish with some work along the connective tissue that supports the spine. I'm just gonna, sometimes this tissue can get really sticky, and it's really healing for the back to just stretch all this out a little bit. It's good if you feel heat building below your hands. It's a good sign. Anytime you're doing fascial work, you want to have that sensation. And taking my hands off nice and slow to finish. And that is all for today. Before we end this video, I'd like to thank a few of our patrons. I'd like to thank Allison Voice, Vettel, and Graham Peel. Thank you guys so much for your support. Thank you for joining us today. I really enjoyed spending this time with you. If you enjoyed today's video, you should check out our Patreon channel. I look forward to seeing you there.
Join us for 14 and 30-day programs, hour-long classes, and much more on our yoga app, Yoga Plus by Psychetruth. It's free to download and features a variety of wellness content, including yoga, fitness, Pilates, guided meditations, and interviews with dozens of wellness experts.